Hello.
Hi.
How you doing?
Good. How are you?
I am fine. How about yourself?
Doing good.
Good. Good to hear that. How's your symptoms and your hot
Everything's
flashes?
about the same. I mean, no grand changes or anything. It's about the same.
What would you say the most two important symptoms that bother you?
The moodiness and the irritability.
Okay. And this is not related to your thyroid.
It's not.
No.
Okay.
Your thyroid is normal. Okay. You know, actually it's in the low end of normal. We checked your thyroid antibodies. Your thyroid antibodies came okay, which tells me that your immune system is not attacking your thyroid. We checked your stress hormone cortisol, came fine. We checked a hormone called calcitonin that can make you have hot flashes sometimes, and that came normal. Your brain is very stressed out because of the estrogen, lack of estrogen.
Okay.
And the bottom line, it comes down to the fact that whether we want to give you estrogen or not, given your family history of breast cancer.
So, did you test the estrogen levels?
Yes.
Okay.
The estrogen level is very low. Okay. If
What should it be?
It should be very low in menopause.
But I mean, where am I on the chart so I can see how bad it is?
Well,
I'm just kind of.
Well, the way how you look at it is, this tells us how much your brain is stressed out with the lack of estrogen. This is the measure of how the brain is happy or not happy.
Okay.
It is kind of, I will say, severe, moderate, or mild. I will say it is mild.
Mine?
Mild. Moderate yours.
Okay, moderate.
Moderate. So it is not a mild, but not very severe.
Okay.
I see people we usually, this goes between 50 and 60 in most menopausal women. Yours is 85. Okay.
Right.
Now you took estrogen in the past and did not relieve the symptoms.
I was on a patch,
Okay.
the 1 milligram patch, and I was having issues with my blood pressure. So they indicated the patch could be making my blood pressure worse. So they decreased the patch by 75%. I went from 1 milligram to 0.3.
Mm-hmm.
And I mean, it's been so long, I can't remember.
Are you still on the patch or
No, well, I didn't think it was working, so no.
So the question is whether you need estrogen or not. And if your blood pressure goes up, then you treat the blood pressure.
Okay.
So the issue is, are you accepting a risk of a breast cancer? And can you live with that risk?
Can I kind of, well, I mean, if I was to take a full, what are you suggesting? A patch, a cream, a pill? What are you suggesting we do?
I would suggest, if we're going to do something, we're going to need to give you a pill.
A pill.
All right?
Okay.
The question is, there is a risk in everything we do in life. And we have family history of breast cancer.
Yes, sir.
You accepted the risk because you took estrogen before.
Yeah.
Right? So how bad is your life? That's the question. How bad you are right now? Quality of life.
Yeah, I'm crap. I mean, I can't think, I can't concentrate, I want to do something, but I guess what my question was, if we went, yeah, let's try it. I was kind of wondering if we were just to try and relieve the symptoms rather than bringing me back to 100%. Can we do a little bit and not increase my risk so much, or is it just the fact that we're going to treat
nobody knows, if the amount of estrogen determines the risk or not.
Okay. I wanted to try something. Okay, and then.
When was your last mammogram?
A year ago. And it was normal.
And pap smear?
About a year ago, normal.
See, I cannot give you estrogen without having you updating your estrogen, your mammogram and pap smear. But what I will do is I want to give you a trial of the estrogen I want to see. And you promise me in the coming 2 weeks to go and see your OBGYN and repeat your mammogram and pap smear.
Okay.
Would that work?
Yes, absolutely. Right. Yeah.
And if I get them back within the month, I will refill your medication.
Okay.
If I don't get them back and they are negative, I cannot refill your meds.
Okay, so, oh wow, that's pretty serious, huh?
Well, I mean, we are talking about you are,
Can I get you the test from the breast clinic?
from last year.
Well,
I want an.
I think it's been, I'll probably do.
I need an update.
I'll take a new one. Okay.
Well,
okay.
now that you are on estrogen, you're gonna need to be more careful than anybody else. You're gonna need to have your mammogram religiously every year. You need to see your OBGYN and have a pap smear every year. Because, the only way to decrease the risk is by doing more screening. You know what I mean?
No, I understand.
So, I want, all right, moderate menopause symptoms. Start Estenel. Estenel, it's a compounded estrogen that is very, very strong. Usually, most of the people, their brain respond to us Estenel very well. Okay, I want to start you on the low dose.
Oh, okay, that sounds good.
And need mammogram and pap smear in 1 month. No refills with no results. Back. And you get to decide this month.
Okay.
See how you are today and see how you are on the estrogen. All right.
Okay.
And we will measure your estrogen level and the FSH. Okay. Repeat FSH and estrogen in 2 weeks. If FSH less than 40, continue same dose. Alright? So we'll repeat the test in 2 weeks. If your brain is happy, we'll stay on the low dose. If not, we will increase it. Because I want to put you on the dose that I will tell you your brain is happy. Tell me my brain is happy but I'm still the same. Then what's the point of taking the estrogen?
Okay, right.
Tell you your brain is happy and you are feeling completely different person. Then is it worth it to go through breast cancer risk? You will decide. You know what I mean?
Okay.
All right. Now, do you have any genetic study to see how much you risk for breast cancer?
No.
All right. I want to send you to an oncologist that they will do also a risk assessment. And they will tell you some people have certain genes, that will...
Is that BRCA?
BRCA and other genetic testing.
Okay.
They will also help you, with this issue. As we're giving you estrogen, a month of estrogen is not going to make you having breast cancer. Okay? It's a long-term exposure. But also you will get to decide how well or unwell you feel. Okay?
This is pretty serious stuff.
You had total hysterectomy, right?
Yes, sir. Complete.
It is serious stuff because you're going to sign a consent for me now that I am giving you estrogen and you are accepting the risk.
Okay. Now, how does this differ from what I was on before?
Nothing. It's the same risk you carry last time and now. You know what I mean?
So, I mean, the medication is the same as the Vivel patch?
No, the medication is Estenel, which is ethylene estradiol. It is a very old medication, very potent, but, because it is generic, most of the drug companies, they don't make money out of it, so they don't manufacture it. That's why we compound it.
Okay.
And they get newer names, but they don't work as good as this old medicine.
Okay.
All right. So in 2 weeks, return to clinic in 2 weeks for estrogen and FSH. See oncology for risk assessment. Dr. Maria Scoros. Alright, I'll give you Dr. Scoros' name. I'll give you the estimate. And just give me a second, okay?
Okay. Hi.
Here's Dr. Squirrel's number, and here's the hormone replacement. Read it, and then the consent's in the back, and sign it up.
Okay.